London's seen the largest number of coronavirus cases of any region in the UK, with 1,706 deaths reported in the capital alone.
At least 10 of those were people who worked on the public transport network, with unions now calling for better protection for frontline transport workers. The Mayor of London, Sadiq Khan, joins us now. Good morning to you, Sadiq Khan. So at least 10 public transport workers have died after testing positive for coronavirus. 8 of them were bus workers. Are we equipping our public transport workers with enough protective equipment as they do that essential work during this crisis?
Well, firstly, I've got some bad news. There's in fact 14 London public transport workers, heroes, who've lost their lives. 9 bus workers, 3 who worked on the Underground, 1 Transport for London, and one of our suppliers. Can I just firstly begin by saying my thoughts and prayers with them, and my condolences go to those families. It's a tragic loss. We are, Susanna, doing a huge amount to make sure public transport is as safe as possible for those that use it, but also those that work in it. So for some time now, we've made sure we've got the most enhanced cleaning regimes we can do. We've learned lessons from around the world. So, for example, we make sure we use antiviral hospital-style disinfectant, regularly cleaning key touch points during the course of a day. So on our buses, not just the bus garages and the depots, but the steering wheels, the handles. We've also made sure there's protective perspex glass with protective film covering the holes, so that the spit from people's mouth can't go from a passenger to...
With respect to you, this is not enough, is it? 9 bus drivers have died. Is that what you're telling us?
9 bus workers, yeah. And so,
they're being sent out every day. You know, we see health workers in full hazmat suits. You're in charge of our transport system in this capital city. You've got to do more. I mean, they can't be sent to their death like this.
We have 48-year-old London driver Nadir Noor, whose widow claims that he and his colleagues had no PPE whatsoever. He drove the 394 between Islington and Hackney and was said to be in good health before he died. No protective equipment whatsoever.
Sure. I was saying that some of the steps were taken, but you've asked another question which I'll come to, which is the issue of PPE. So on a number of occasions, we've sought advice from not just Public Health England, not just the Department for Transport, not just the Department for Health, but also the World Health Organization. What they've told us is that personal protective equipment should only be used in care settings. You know the shortage there is of PPE anyway for the NHS and for our social care staff. And as recently as yesterday, we rechased the government to get advice on this. And their advice is quite clear, that transport workers should not be wearing a PPE. Notwithstanding that, we've made sure that...
Sorry, Mr. Khan, are you saying they shouldn't be wearing PPE because they're not at risk, or they shouldn't be wearing PPE because we simply haven't got enough of it? Because if it's the latter, that is another example of our lack of preparedness for what was coming down the line. Would you put your drivers and your bus workers and your public transport workers into PPE if it was available?
What I do is follow the advice from the WHO and Public Health England. Their advice is, and I've got to follow their advice, is in non-care settings, people shouldn't be wearing PPE. You raise a separate point about even if we wanted to, because of lack of planning, we haven't got the PPE. We don't go to the second point for the simple reason the advice from WHO, DfT, Department of Health and Public Health England is for
Mr.
PPE.
Mayor, I'm sorry, but with respect, where does common sense come into this? All I hear is politician after politician hiding behind advice. And what I don't see enough of is common sense. If 9 bus drivers in London have died from coronavirus because every day they're being sent out to risk their lives without adequate personal protective equipment, if I was a London mayor, I'd be making damn sure they got it, and I wouldn't be taking any advice from anybody else. I'd be trusting my gut instinct. These people need better protection. They are dying.
And to be fair, the first question I was asked, I was answering some of the steps we're taking using common sense and science. And to be fair, you asked me a second question before I answered my first question.
You just said you were acting on the advice of the experts, which is not to give them PPE. I'm just putting back to you your own words.
You know, with respect, Piers, the first question Susanna asked me was in relation to public transport in London. and I was setting out some of the steps we're taking. And I'm really happy to explain some of the steps we're taking because it is personal to me, Piers. You will know, not just that my dad is a bus driver, many of my friends and people I know work in public transport, and I work regularly and closely with the transport unions, including speaking to bus drivers and those in the front line on a regular basis.
Okay, well, let me clarify your position then, because I thought your position was that you had sought advice on whether PPE was required for bus drivers and other workers on the transport system, and you had got the advice it was not required, and therefore you were acting on that advice. That's what you said. Now, is that your position?
The position is on public transport on buses. The steps we're taking on buses include the enhanced cleaning regime, which I've talked about, which is not the advice originally, but we're doing this over and above the advice. You mentioned common sense. So we're using antiviral hospital disinfectant. We're also over and above the advice using 30-day longer lasting antiviral disinfectant.
This is not enough, Mr. Khan. I'm sorry. This is not enough. If I was, you come from a family of a bus driver, right? There will be families all over London whose husbands, whose wives are going out as bus drivers today, who have just heard that 9 bus drivers have died, and a bit of antibacterial gel is not going to cut it. And if, I'm sorry, I don't want to tell you how to do your job, but I do think that common sense has to prevail. And if you can get access to PPE for bus drivers in a way that they can still drive in a safe way, then they should be in it, shouldn't they?
Well, there's a number of other steps we're doing, not antibacterial, by the way, antiviral. We're also, for example, we've got protective film between the passenger and the buses. With bus drivers, we've also made sure no passengers are sitting near to bus drivers. We're also making sure in London, we're lucky. We've got one door to come on for passengers and one door for passengers to leave. One of the things we're doing is seeing if just using the back doors keeps passengers away from the bus driver. The concern there is it can lead to too much social interaction between passengers. We've still managed to provide 90% of the buses, so we don't want to inadvertently, because we're avoiding passengers coming into contact with drivers, have too many passengers coming into contact using the back door. At the same time, we're speaking regularly with colleagues around the world to see what they can be doing. One of the things we do know does work is keeping distance between passenger and bus driver and passengers from each other. So people have seen...
Again, look, I don't run a transport system, but the bus drivers should have zero contact with any passengers. So whatever you need to do, they should not be coming into contact with passengers, not least because 9 bus drivers have died of coronavirus and might be infecting the passengers. So clearly the first thing you've got to do is shut down any contact, isn't it? Second thing I would be doing is putting them in proper PPE in a way that allows them to drive but protect themselves. I mean, this just strikes me as common sense. And what really worries me about some of the things that we're doing as a country politically is everybody hiding behind advice and not trusting this. 9 drivers have died, right? They're all going out today knowing 9 others have died. This has got to stop.
Piers, can I just explain, because it's really important that the public understands what we're doing and bus drivers. So in London, which is different to other parts of the country, there is a perspex barrier between bus driver and passenger. And that perspex barrier has on top of it a protective film. As of yesterday, all 9,000 of our buses now have this protective film between passenger and driver on top of the perspex glass. So to reassure you, because it's really important that we reassure not just bus drivers but their families, the protective film and the perspex barrier between the driver and the passenger is more than any bus has across the country. And you're right. We need to reassure bus drivers and their families that our buses are as safe as they can be.
OK, Mr Mayor, please do your best for these workers, because, honestly, it feels like they're just being ignored in all this. We've got to adequately protect our health workers. Well, yeah, Piers, if they're not in PPE, it would seem to me not enough is being done.
Yeah, but can I speak? I've really got to challenge you. They really aren't being ignored. Please don't say that. They really aren't. It is personal, and we are making sure we have got steps in London that are world leading in this area. I wouldn't want anybody to be under the impression that we're neglecting or ignoring our bus drivers or our transport workers. They're as brave as the NHS and care workers and the fire service and the police.
They're not getting the same protection in terms of personal protection equipment, because you're acting on advice and you're not doing what I think you should be doing, which is sticking them in PPE. That's what I'd be doing.
Well, in London, we're taking all the steps we can do to keep our public transport safe, not just for our staff, really, really important, but also for passengers as well. And notwithstanding the large numbers of staff that are absent, almost a third, we're still running almost 90% of our buses and more than 55% of our tubes. And that's thanks to our heroic transport workers.
They are.